Fever FM, the number one choice in Leeds.
Right, ladies and gentlemen, good afternoon. If you just tuned in, this is the Together We Can project funded by the Big Lottery Community Fund. And today's special guest is Kamal Sambi Ji, and he's our local optician. So welcome, and good afternoon, Kamal Ji.
Good afternoon. Good afternoon to you, Jabbar. Thank you for inviting me today to talk about eyes.
Oh, it's very important. I think if we can help our listeners.
It is very important. I mean, regular eye tests are important because with eyes, they don't often hurt when things are going wrong. So if things do begin to go wrong, then they have to be detected early because the earlier problems are detected with eyes, the better is the treatment.
So you're suggesting regular eye tests?
Absolutely, regular eye tests. I mean, if you're an adult between 16 and 70, then it should be every 2 years.
Okay.
Under 16s, every year at least. It could be every 6 months, depending on if there's a problem. For example, short-sighted children often need to be seen every 6 months because their prescription changes quite regularly. And also diabetics, they should be seen more regularly, at least every year, because with diabetics they have a raised blood sugar level, which can damage the back of the eyes. And the way it does that is by damaging the blood vessels that are in the retina, and the retina is the part of the eye which gives you the vision. So whatever I'm looking at now, okay, the light from you is coming into my eyes, it's being focused on the retina, and that image that's formed on the retina is then sent to the brain and telling me that I am seeing Jabbar.
Oh,
okay?
wow.
Yeah.
Okay.
So if that retina becomes damaged, then that's going to affect the sight. So particularly in diabetics, it's very important to have regular eye tests. And also, if between their eye tests, if, for example, they're on a yearly recall, if after 6 months they feel that the vision has changed, then they should go and see their optician earlier.
Okay,
Yeah.
okay. So regular eye tests every 2 years or every year?
Every year, yeah. For children, every 6 months, if necessary. Yeah.
Why is that? I thought children have better eyesight than older or senior people.
No. With children, quite often they won't say that there's a problem. So it's important to get your child seen by an optician, fairly early on. I mean, eye examinations are done by doctors straight after birth.
Oh, okay.
Yeah. I mean, they will do a screening test. They will have a look at what we call the back of the eyes to see if there are any congenital defects in the eyes. So for children, it's very important. And also, if children don't have good eyesight, then of course that's going to affect their education. Because if they can't see the board, if they can't read properly, and like I said, quite often children will not tell you that there's a problem, and they'll begin to fall behind at school, and that obviously is going to have a detrimental effect in their their long-term education. So it's very important.
Very important that they do get regular eye tests.
Absolutely.
And it's down to mummy and daddies really to make sure you take your child and get regular eye tests. Really.
Yes. And also what we have to look at is also it's not just checking the eyes, but it can also give an indication of the general health of the person as well. For example, like I just mentioned, diabetes, that can be detected in an eye examination. Also conditions like glaucoma, where the pressure of the eye increases. And that's quite common in the more common in the Afro-Caribbean population, and also in the Asian population as well.
Okay.
And if the pressure is high of the eye, then what that can do is it can affect the optic nerve at the back of the eye, and that is the nerve that connects the eye to the brain. So if that becomes damaged, then that will have a direct effect on the sight. And if the pressure is high, then it needs to be lowered, and it needs to be lowered kind of quickly. So treatment has to be initiated fairly early on, because if it's left then you could cause irreparable damage to the optic nerve, and then nothing can be done. And so it's really important to have regular eye examinations, to have the pressure checked. I'm sure a lot of the listeners have experience of having their pressures checked. And there's 2 tests you can do. Either you put drops in the eyes, and then a little probe is touched on the eye, or it can be a little puff of air, which can check the pressure. And that's a very common test that you will find in an eye examination, particularly on the over 40s.
Okay. Right. Apart from eye examination, eye tests, I mean, what can the listeners do to safeguard their vision, really?
Anything that, well, first of all, stop smoking.
Okay.
Yeah.
Smokers are...
absolutely.
Really?
Yeah, because...
So all you smokers out there, listen.
Yeah, it's not, because smoking increases your risk of developing cataracts, and also increases your risk of developing, and I will go through what cataract is in a second, increases the risk of developing what we call macular degeneration.
Okay.
So a cataract is basically... it's when the lens at the back of the eye, you've got a lens at the back of the eye, okay, which is responsible for focusing the rays of light that come into the eye onto the retina. Now, in a cataract, that lens begins to get misty and cloudy. Fortunately, it's quite treatable. It's a small operation, and the success rate of that operation is very high. But also you can develop, like I said earlier, a condition called macular degeneration. And that is basically, you have a part of the eye which is called a macula, and that part of the eye is the part of the eye which gives you the sharpest vision. And you can begin to get little breaks in that section, wear and tear. Well, it can be age-related, but if you're a smoker, it can happen earlier. And if that happens, then... there's 2 types. There's what we call the wet, and there's the dry macular degeneration. Wet is when you have little blood vessels that have burst in that section of the retina. Okay. Now, that can be treated by injections, but if it's the other type, which is the dry one, then there's little can be done about that. So you want to try and prevent that really by kind of stopping smoking.
Stopping smoking,
yeah.
Okay. I think all these smokers out there will be thinking twice now. Okay, right. Thank you for that. And the other one, we had a text message here saying sugar is bad for eyesight, hence lots of diabetic patients wear glasses. Is that true?
Well, yes, sugar. If you're a diabetic, then you do have a risk of developing what we call diabetic retinopathy. And I said earlier, that's when you begin to get leakages of blood vessels on the retina. A little bit is okay, but if it's left untreated and undiagnosed and unmonitored, then it can, if it worsens, lead to blindness. So if you are a diabetic, it's really important that you keep your sugar levels well controlled, because that's going to govern the long-term health of your eyes.
Oh, wow. Okay, that is... quite scary, really.
Yeah.
Right. Are some people more at risk from eye disease than others?
Yes, like I said, diabetics. Also, if you're over 60, then you're more at risk of developing things like cataracts, glaucoma, macular degeneration. They're age-related as well.
Okay.
And also for the over 60s, it's important to have their eyes tested, because if they've got blurred vision, they're more at risk of having falls.
Ah, yes.
So,
yes.
It's important that they have their eyes tested and get the appropriate kind of correction to give them the sharpest vision possible.
Okay. One of the questions I had was is TV really bad for your eyesight?
There's no
evidence
to suggest that it can damage the eyes physically. Although watching too much TV will cause fatigue, and if you're fatigued, then perhaps. That may affect your concentration. Even things like computer work. If if you do too much, then your eyes can become fatigued.
Yeah. I know my eyes hurt if I watch a long a Bollywood movie. About 3 hours, I'm like, oh, my eyes are hurting.
Yeah, it can lead to fatigue.
Yeah.
But what's also important is, particularly if you're doing computer work, is that the two eyes have to work together well.
Yes.
Okay, and an optometrist would be able to tell you that in an examination. Because if the two eyes are not working together well, then that increases the strain on the eyes, and sometimes glasses can be prescribed to help with that.
Okay. Right, this other next one I got for you. Are carrots really good for your eyesight, or is it just a myth?
Well, no. I mean, in the during the kind of the First and Second World War, they used to give carrots to soldiers to help them to see clearly at night.
Oh, okay.
Yeah. So it certainly does help with night vision. But what you get from carrots, you get from other parts of your diet. So eating more carrots kind of in the Western countries wouldn't really...
No.
Yeah, wouldn't really benefit because you're getting all that from other parts of your diet. So
is part of our diet actually can improve your eyesight or not?
No, it can't improve your eyesight, but having a good diet can help maintain the health of your eyes long term.
Oh, okay. So if you've got a decent sort of
absolutely,
eyesight.
Lots of greens, exercise as well. Okay. It all helps with it, and like stopping smoking. That all helps with keeping your eyes healthy long term.
Oh, okay.
Because if your diet is poor, if you eat a lot of sugary foods and a lot of fatty foods, then you're more at risk of diabetes, and then if you get diabetes, then you can get diabetic complications. So yeah, absolutely. So stick to a healthy diet, lots of greens, cut down the sugars, cut down the fried heavy foods, and that will all help.
Okay. Right. Is there a problem when someone is blinking more than others?
It depends. If they're blinking because their eyes are irritating, then that could be a sign that there's a front surface of the eye called the cornea, that there may be some issue with the cornea, perhaps some drying or perhaps a little bit of perhaps small abrasions on the cornea. So if you're blinking and you're blinking because your eyes are hurting, then you should really go to an optician and have that checked out. But a lot of children, they blink just out of habit. So I mean, I get a lot of patients to me saying, "Oh, well, Satinder here is, he's blinking a lot, but he's not complaining of any pain, and he's not complaining of his vision." So that often is just habit related, and as they get older, they kind of fall out of that habit.
Okay. Yeah. So nothing not to worry too
not
much
to
about.
worry, but if the blinking is associated with irritation, then you should really have your eyes examined.
Okay, yeah. I've got one here. It says protecting your eyes from the sun.
Absolutely, yes.
Absolutely,
yes,
okay.
yes. So when it's sunny and you're outside, you must wear a good pair of sunglasses with a good UV block. Because if you don't, then you're putting your eyes at risk of developing conditions like cataracts. So yeah, absolutely, you need to wear a good pair of sunglasses, not the cheap ones.
No,
because they can actually do more damage to the eyes. Because if they haven't got a good UV block in them, what happens is that when you put a pair of sunglasses on, your pupil dilates, and that lets in more harmful rays.
Oh dear. Okay.
So it's important to have a good UV block in your sunglasses.
So anyone, well, first of all, you recommend sunglasses on a sunny day.
On a sunny day with a good UV block.
With a good UV block.
Yeah,
So check the label on whichever glasses you're going to purchase.
Should be to British standards, yeah.
Yes. There you go. So it's good advice from Kamal ji.
Yeah. But another thing when we were talking about children, this is really important, is that children can get, we don't like to use this term, but I will, because this is the term that most people will be familiar with. They can develop what we call lazy eyes.
Okay.
We prefer to use the term amblyopia now. And what lazy eyes can result in children, first of all, as a result of a turn in the eye. Have you ever seen children whose eyes, one of the eyes will be in the corner or drifting outwards? So if you notice your child if you notice that your child has a turn in the eyes, then you must get that checked very, very quickly. Because if you don't get that checked quickly, then there's a risk that eye which is turning could could have permanently low vision. So that needs to be treated very early.
And it can be treated?
It can be treated, but it's got to be early. It's got to be done before the child is kind of 7 years old.
Okay.
Because after that, then the visual system becomes fixed, and then it's harder to treat then. So it's important to get that checked if you notice your child eye is turning one way or the other.
Okay, there you go. But like you said earlier on, get your child to have a regular eye test and examination every 6 months, you mentioned?
It can be every 6 months. It should be, as a routine, it's every year. But if, like I said, they become short-sighted, then they can be seen more often because the prescription often changes kind of every 6-7 months. So, yeah, I mean, I see children who are short-sighted kind of every 6 months.
Okay. But it's good to get regular tests done, really.
Yeah.
Okay, right. Right, we got here Nasser. It says people who take steroids for muscle building has eye blinking. Is this side effect of the drug?
No. Eye blinking I've not heard of, but certainly long-term steroid use can have detrimental effect on the eyes. First of all, they can increase the pressure of the eyes.
Okay.
And like I mentioned earlier, if the pressure goes high, then that will affect the way the optic nerve functions. And it could cause damage to the optic nerve, and that damage can be irreversible.
Oh, dear.
And also, long-term steroid use can cause cataracts in the eyes. So,
really?
Yeah. So
mind you, I wouldn't touch
so
steroid.
I wouldn't recommend using steroids for bodybuilding at all. I think it's illegal anyway, isn't it?
Yeah, I'm sure it is. Yes. But that doesn't stop bodybuilders dabbing into it. Yeah. But there you go. Okay. Ashok Saab says, Jabbar, what if is jahan ke nahi hai tumhari aankhein?
Is jahan ke nahi hai tumhari aankhein?
Yeah, that's a song, isn't it?
It's poetical anyway.
I'm sure. Thank you, Ashok.
I don't think he wants an answer to that.
No.
I think he just wants us to appreciate his poetic skills.
Yes. Yeah. No, I'm sure. I know that. That's a song. It is a song, right? He's probably asking for that song, isn't he? Yes. He says that song will go nicely in your show.
Absolutely.
It's Jahan say, no, it's. इस जहां की नहीं है तुम्हारी आंखें. Oh, King Uncle. Is that a movie? King Uncle.
There is a movie called King Uncle. It's Jackie Shroff's movies. Yes. I think it was in the early 90s.
I think it is. And Ashok always asks for 90s anyway. So bless you, Ashok. But we are more interested in relevant questions to do with your healthy eyes, really, or if you have healthy eyes. Yeah. I'm sure.
But just one thing I want to say when I mentioned steroids: if your doctor has issued you steroid use, then you must keep using them the way the doctor has prescribed. I don't want people to stop kind of using steroids because I'm saying they can cause damage to the eyes. If the doctor has issued them, then you need them, okay? And the doctor will make sure that any relevant checks are done to make sure that they're not kind of having any detrimental effect. I just want to bring that in. Yeah.
Absolutely,
okay.
because
so if your GP has prescribed steroids, then you must take them.
Yeah, okay. Because you mentioned steroids are illegal, but then I thought,
for bodybuilding, I think they are.
Yeah, for bodybuilding. Yeah. But I do know.
But for medical use, they use often, but for many conditions. So, and if you have a condition that requires steroids, then you must take them. If your GP has directed you to take them.
Absolutely.
Yeah. Okay.
Absolutely. Thank you for clearing that off. That's very important, of course.
Yeah.
So, shukriya. And Tamre Saab says, Salam Jab advice in Urdu or Punjabi for people with diabetes. Listeners request yesterday. Oh, okay. Someone requested a bit of information for diabetics sufferers to do with eyesight, but they would like it in Urdu or Punjabi.
ये कोई बात नहीं अगर आपको डायबिटीज़ है तो बहुत ज़रूरी है कि आप रेगुलर आई टेस्ट करें. वैसे हॉस्पिटल भी वो स्क्रीनिंग टेस्ट करते हैं जहां आप पीछे जो आँख का जो मांस है ना आप चेक करवा सकते हैं. उसको डायबिटिक स्क्रीनिंग कहते हैं और क्या करते हैं कि वो ड्रॉप्स डालकर फ़ोटो खींचते हैं आँख की. Okay, so काफ़ी डायबिटीज स्क्रीनिंग प्रोसेस पे होते हैं. So वो उनका देखभाल यानी कि हो रहा है. लेकिन अगर आप महसूस करें कि नज़र कम हो रही है और आप डायबिटिक हैं, तो ज़रूर आप ऑप्टिशियन के साथ अपॉइंटमेंट बनाएं और चेक करवाएं. क्योंकि अगर कुछ डैमेज हो रहा है तो उसका ट्रीटमेंट जल्दी करना चाहिए, क्योंकि अगर नहीं जल्दी किया तो फिर अंजाम ख़राब हो सकता है.
There you go, there you go. Yeah. So anyone suffering from diabetes, get your eyes tested early as possible and regular as possible, and keep a decent diet, he says. Okay, he says...
yes, absolutely. If you're diabetic, you must keep the sugar levels controlled.
Absolutely.
Because that's going to govern the long-term health of your eyes.
I got a shock, Saab. He's on one today. He says, and the last question, ask the doctor to confirm listening to Fever FM is good for your eyes.
I'd say it's good for the soul.
Oh, good for the... yeah. Well, there you go, Ashok. Thank you very much for that.
It's good for my soul when I present the shows. So I hope the listeners are feeling the same kind of, the same feelings as I do.
Absolutely. Right. I was just saying earlier on that, whatever happens in my life when I'm doing the show, all my stress just disappears. Yeah.
My stress disappears listening to you, Jabbar.
Oh, thank you very much. Right, it is exactly 1:31. We're going to go into the commercial break. So we're still with you. Don't go away yet, Dr. G. And we'll be back after this. And please, if you have a question for Doctor while he's here, the magic number is 0750 3388 694 to text in for your question. And I'll be more than happy to ask him while he's